Hello everyone, I'm Pastor Philip Johnson. I head up the patient coordinator department here at Sponaugle Wellness, where Dr. Rick Sponaugle treats patients from all over the United States, Canada, around the world. We are a wellness center, and our goal is to help people recover the lifestyle that they've lost due to so many complications that arrive from environmental toxins, Lyme disease, brain chemistry issues. And so we have a wonderful story here to tell today, and I'd like this young lady here to introduce herself. Tell us your first name.
Hi, I'm Emily.
Emily, where are you from?
I'm from West Virginia.
I love West Virginia. That's awesome.
It's pretty cool.
And how old are you?
I am 26.
26.
Yes.
So Emily, nobody here knows anything about this story.
Okay.
And they can look at you and say, man, this girl's got it going on. She looks great. And so was it always like that? Tell us what brought you here.
No, it's not always been like that. I came down here because I had been an opiate addict for 10 years. Started on tramadol, went through the different things, ended up on Suboxone, Subutex. I then started shooting up, the Suboxone and everything, and you name it,
So you kind of became a little bit of a chemist in the process.
Unfortunately, yes, yes. So we found this place down here. We saw it on a Dr. Phill show.
Right.
And I was on an airplane 2 days later down here.
Okay.
I've been here 3 weeks
Right.
on Detox. Completely painless detox.
Awesome.
It was amazing, you know. I feel really good, but I was diagnosed with 5 strains of Lyme disease, black mold toxicity, toxoplasmosis, the Barbella, the Babesia. I had no hormones. My immune system was shut down. My gut was very, very messed up. And in 3 weeks, I went from like 0 to 100.
Wow, you said a whole lot in a short period of time.
Sorry.
Okay, no, we need to go back. This is incredible.
Okay.
First you're talking about, an addiction.
Yeah.
So you came here for a detox program.
Yes.
But it's in all of our detox program, it always includes a wellness protocol. And a lot of that goes back to the brain. What's going on in the brain? Why do you have the cravings? Why are you benefiting from an opiate? Some of that's genetics, some of that's toxins, these type of things. So no doubt Dr. Sponaugle went into some detail about all of that.
Yes, a lot of detail. Yeah.
And it explains a lot. A lot of people say that, that explains a lot of things that have gone on in my life.
Oh, yeah, yeah.
Just the brain chemistry part of what we do. And our detox program literally works that way. We might call it, walking off the drugs. You said the detox was basically painless. We avoid the whole, were you afraid of detox? Have you tried to detox before?
No, never. I was terrified of it. That's why I was on it for so long.
Yeah.
And that is an opiate addict's worst fear, is the withdrawal. But, I watched a bunch of testimonies on the site, and, we felt like it was the right place, and it definitely was.
Gary was your plan of care nurse to
Yes.
walk you through all of this, and he's very good
Yes.
in what he does. And again, we call it walking off the drugs because, we're working from 2 different directions. We're dealing with the drugs and decreasing that and weaning you off the drugs. But at the same time, we're doing the wellness protocol. We look at the brain chemistry. We looked at this whole list of things you just mentioned. You got well, we simply call it bugs. You got the bugs. You got the mold toxicity going on, which, and this is where, and I wish anybody watching this that is dealing with an addiction, whether it's drinking, whether it's drugs, you may feel like. Most people feel like, is it just me? Is there something wrong with me?
Oh, yeah.
What happened to me that I just do this all the time? But what I want you folks watching this to understand is that when the brain chemistry gets imbalanced, when you get possibly toxins hitting the body, which cause the brain to become over-electrified, when that happens, you deal with anxiety and panic attacks and depression and, just urges that come upon you.
Yes.
And then if you have genetics in place that perhaps are burning dopamine pretty quick,
that one.
always wanting craving. It's always craving a dopamine hit of some
Yes.
sort. And so it's not about whether you're a good person, a bad person, a spiritual person, whatever.
Right.
It's about medically addressing these things. Had a great experience in 3 weeks. You had our healing IV therapy every day.
Yep.
And was there any particular thing about the treatment that you especially saw a result of, or you look back and think, wow, that was awesome? Or
I mean, just the whole thing. I mean, just getting those IVs, the drips every day, I mean, they make you feel very good. But I mean, my skin color's better, my hair's thicker, my nails are longer. I just feel, in 21 days, I feel like I'm a different person. I mean, really.
No, that's wonderful.
And everybody I've talked to, my family's like, you sound so good. Like, you sound like you have life in your voice now, because I was in a very, very bad place.
Well, absolutely. But when you're, adrenals and hormones and thyroid and wellness panels, immune system, when all these things have been compromised because of toxins, whether environmental toxins or the Lyme, the bug, the co-infections, these type of things. So, going back home, it's important for you to avoid mold. If that's,
if that's possible.
If that's possible.
Yeah.
Of course, we try to teach about mold here and how to try to avoid it, how to look for it. It is causes so much problems to us. It can affect that brain chemistry and cognitive issues and decreased assimilation of knowledge, as well as all the physical issues that go along with it. All right, so you feel confident about going home?
Yeah, I feel really good about going home.
All right. All right, is there anything else you want to add to the folks that are watching this here today?
You really can get off opiates with no pain. I mean, it's amazing, and it's all like natural things that your body craves. I mean, I burn up dopamine 4 times faster than normal people from a gene I inherited.
Yeah.
I did think something was wrong with me. I was like, why do I love drugs so much? But I just felt so bad before. Never dreamed I had the Lyme and the mold, but and I don't believe I would have been diagnosed with that anywhere else. I mean, I'm a nurse, and I've never, we didn't learn much about it.
Obviously, somebody had diagnosed you in the past, and their answer was to give you Subutex or Suboxone.
Yes,
that was the remedy to your problem.
Yeah.
Which basically just feeds the addiction, and those Subutex, the methadone. Those are very, very addictive drugs.
Oh yeah.
To try to get off of,
and they're very dangerous.
Very dangerous as well. And so there is other options.
Yes, there are other options.
And we do try to go with the all-natural approach and to try and help all that. Well, it's been a pleasure having you here in this conversation. I'm sure that folks that are watching this are going to be encouraged.
I hope so.
By the words that you've said, and you get the chance to go back to the life you love and
Yeah.
Look out, West Virginia. Here you come.
I know. It's definitely going to be way better.
All right. Good deal.
All right.